Angie came into my life around January 2021. I was born into quite a big family. There's like 16 brothers and sisters all together. There is some issues with the family. My dad was a drinker. I'd lost my brother to an overdose. My mum really wasn't like the best of mums. She was abusive to us, mentally and physically. When I was 17, I got into my first proper relationship and he was violent to me. He broke my nose on several occasions, just always used to hit me and things. So I moved back down to Oldham to try and better my life. After about a year of working, I fell pregnant with Clayton. I was sofa surfing at the time. I was living with my sister at this time. The pregnancy was vile. I was sick every single day up until I gave birth. I was even sick after I gave birth. I moved in with my dad. He just ended up losing the house due to rent problems. He couldn't afford it. Before we even got evicted, the house just got absolutely destroyed. We didn't even have a door on the door frame. Windows were smashed. We was left with nowhere to go. I wasn't safe in that house. I couldn't have stayed there with Clayton, and that's when I presented myself as homeless. We got put into a homeless hostel. It's a bit scary. First day, not knowing where to go. Angie and Roz helped me to get to the place where I was, so I knew where I was going.
How old was Clayton when you went into the accommodation for the first time?
He was just over 1. We had all the screenings done in pregnancy. There was no indication that Clayton was going to be disabled. He just wasn't meeting milestones, no matter how much he tried. He wasn't strong enough. He got diagnosed with Merzbacher disease, a rare condition that affects the myelin sheath in the brain. Set messages Clayton doesn't receive. His brain could tell him to pick something up, but then the only message he might receive is just to pick the hand up, not actually bring it to himself. He can't bear weight in his legs. He has hypotonia, which is low muscle tone. He's registered blind. He has spasticity in his legs, global developmental delay.
How did you feel about the genetic result that you were given?
I was more angry more than anything. I'm one of 9 kids. Why just me out of all them 9 kids? But then I started to see the good side of it too, because we got told that Clayton might never walk or talk. Even though he can't do these things like normal kids, he is still showing determination to get. Yeah, he's so happy. When I got the diagnosis, I said to Angie I wanted to be sterilised because it is a big job to be sterilised, and there's so many like life changes you could want kids in the future. I have stuck to like contraception in case I do change my mind. I found it difficult, and Angie had to support with the implant and things and depot and keeping on top with it.
Can you list for us the number of services that you think you've been involved with to this point, because there's only 2?
So we had the health visitors, midwives, GP. Roz was classed as focus care. Angie, community nurses, occupational therapy, community occupational therapy, neurology, paediatrics, genetics, the eye hospital. Even though there is quite a few people involved, quite a few people have also left us because we're just progressing and doing well. There's not a lot that they can help us with. I feel like I have more of my own voice now, so I found like the confidence to stand up for Clayton and his needs and just get us everything that we're entitled to. Clayton has like special seats. He needs upper trunk support, otherwise gravity will just pull his body back down. He has extra help in nursery. He has a one-to-one support worker that comes in and helps. He has a visual impairment nurse that comes in. Sarah also helped to get his EHCP plan. There's a charity called Victor. They've sent Clayton sensory boxes. We get access to a lot more support. I want him to have everything that I never had, so that's a big part in everything that I do for him, pretty much.